my role with the Oral Health Foundation is to guide the foundation in the direction of preventing decay within the UK and worldwide, really. It's a really fulfilling role, and it means that I can go into areas in the society and understand where our decay is going to, and also understand how we can prevent that, what strategies we need to apply to start hitting the areas in the society who have got the highest decay needs. For example, the majority of decay is in the lowest area of society, which is really helping me develop my strategy within my own business to focus on the homeless, which is one of my practices focuses on, the hardest to reach in society, and the highest decay patients in the country, really. When you have a young child come into surgery who's 3 or 4, my practices are based in Salford, which is some of the poorest people in society live there, and they've got the highest decay rate. So you're actually looking at patients who, in a fully preventable disease, need to be put to sleep to remove those teeth. And it's something that shouldn't happen in society now, and it's a real personal drive of mine. Stop having to take a child's tooth out. It breaks your heart. It's really emotive. So you're dealing with the parents, you're dealing with the children, and it's something that's fully preventable. So oral health is the driving force behind that. Patients, it's really challenging. We as a profession are fighting against very big corporate finance with regards to marketing, with regards, especially my children. You'll come in and my child will know the name of a new chocolate brand because they've seen it between television programs with adverts. Now, as a dental professional, often that patient doesn't realize how much sugar is just in a smoothie drink, is just in a supposed healthy snack. So we have to educate, we have to work with our patients to say, understanding the snacking when they should be actually eating sugar. I'm not going to be able to say to parents, no more sugar in your child's teeth. I've got to educate them, I've got to change their behaviour into when they should have those sugar snacks, what they should be thinking of eating, and understanding what is good for them and what their oral health changes in their regime needs to be. For example, we were often taught by a generation of people who had really bad oral health. So there's a reason they've had the really bad oral health, and we're fighting often against multiple generational behaviours, and it can be a light bulb with a patient. I had a patient the other day who literally had never brushed his teeth correctly. I needed to do 15 fillings in his mouth and 7 extractions, and I did something as stupid as a disclosing tablet, which was 8 pence. We popped him in his mouth, we gave him an electric toothbrush, he brushed with his teeth, and he literally was, my teeth actually feel clean. So having those little wins is what I qualified to be a dentist for. So, simple. Dentistry is simple. I'm not a very intelligent person. I need really simple messages to work with my patients, so I get every patient giving these messages. Brush twice a day with an adult fluoride toothpaste. On the back it says 14 to 50 parts per million. All my patients use that, even the children. I'm in a very high needs area. So talk to your dentist on what would be the best toothpaste for you. After you've brushed your teeth, don't rinse out with water. Just spit out. If you need to rinse out, use a mouth rinse, so you keep that fluoride in your mouth. You just spent 2 minutes brushing those teeth to get fluoride everywhere. Now, by rinsing with water, you rinse all of that out and negate the fact. It stops it working. Keep sugary snacks to meal times. That includes fizzy pop, cordial, even a sugar in your tea or coffee. Remove that. If you can put that to meal times, I don't mind. But make sure you're reducing that snacking throughout the day. And then if we're looking at something like your children, I fight with my children constantly about sugar. They've seen an advert here, they want this, all their friends can have things. So have a day where they're allowed to have it. Just one, so you control it. After school on a Friday, when the bedroom's tidy, in my case, it's a real winner. My little boy's bedroom is actually tidy, funnily enough, on a Friday. And he can have his sweets then, or his chocolate, or have a little, but then brush his teeth afterwards. It's all under control.